Imagine this. You're sitting across from a potential caregiver. Their resume in your hand. This isn't just any interview. It's an audition for someone who may soon become an integral part of your client's life. A life complicated by the nuances of dementia. The weight of this responsibility can't be overstated. How do you ensure that this person is not only capable, but also compassionate, understanding, and patient? The interview process you follow can make all the difference, and mastering it is both an art and a science. Understanding the role of a dementia caregiver. Dementia caregiving goes beyond mere assistance with daily activities. It requires a deep understanding of the client's psychological and emotional needs. This role demands not just skill, but an immense amount of empathy and patience, as caregivers often need to handle situations where they are misunderstood or even forgotten by those they are helping. Caregivers need to be equipped to handle the fluctuating nature of dementia, which can see patients swinging from moments of clarity to periods of confusion. The emotional toll on both the patient and the caregiver can be significant, making emotional resilience a key trait for anyone in this role. Understanding these elements not just helps in framing your interview questions, but also sets the expectations for the kind of person you are looking to hire. The right caregiver can make a profound difference in the life of someone with dementia, providing not just care, but also companionship and comfort. Preparing for the interview. The environment where you conduct the interview can influence the openness and comfort level of the candidate. Choose a quiet, welcoming space that is free of distractions. This setting should mimic the calm and supportive environment you would want for the care of your client. Preparing the right set of questions is crucial. These should not only assess the technical skills and experience of the candidate, but also delve into their behavioral and emotional aptitudes. Tailor your questions to tease out not just what the candidate has done in the past, but how they think and feel about their work and those they care for. Key attributes to look for. Look for patience, empathy, and reliability in your candidates. These are non-negotiable traits for anyone who wishes to work with dementia clients, who may require repeated explanations or may not remember recent interactions. Experience in handling similar caregiving situations and specialized training in dementia care are significant pluses. These qualifications suggest a serious commitment to their profession and a better preparation for the challenges of the job. Can you tell me about a time you faced a significant challenge while caring for someone with dementia? How did you handle it? This question aims to uncover real-life examples of how the candidate has previously navigated complex care situations, offering insights into their problem-solving and emotional handling. Listen for answers that show a deep understanding of dementia's impact on behavior and an ability to adapt caregiving strategies accordingly. The candidate's responses will reveal their level of empathy and their problem-solving capabilities in real-world scenarios. How would you handle a situation where a dementia client refuses to eat or take their medication? This question tests the candidate's crisis management skills and their ability to engage creatively with patients to ensure their well-being. The candidate's answer should demonstrate a blend of compassion and practicality, showing that they can maintain the dignity of their patients while ensuring essential care tasks are completed. Positive body language in an interview can include consistent eye contact, nodding, and leaning slightly forward, indicating engagement and interest. These nonverbal cues can suggest that the candidate is genuinely attentive and connected to the discussion. Be aware of body language that shows sincerity and a real connection. A candidate who mirrors your body language, smiles genuinely, and shows open hand gestures may be more emotionally attuned and empathetic, which are crucial traits for a caregiver. Red flags in interviews can often be subtle, yet telling. Inconsistency in responses or a lack of detail about past caregiving experiences can be red flags. Also, be cautious of candidates who speak negatively about past clients or employers, as this can indicate a lack of professionalism or empathy. Furthermore, a candidate who seems overly confident or dismissive of the challenges posed by dementia care might not be realistic about the demands of the job or might lack the necessary patience and compassion. On the flip side, there are certain green flags to watch for during interviews. Candidates who ask insightful questions about the client or show a genuine interest in the specific needs of the person they will be caring for are showing green flags. These behaviors indicate a thoughtful and proactive approach, which is critical in dementia care. Additionally, watch for a candidate who speaks passionately about their role and shows a deep understanding of and empathy for people with dementia. These traits suggest a caregiver who will go beyond basic duties to truly enrich the patient's life. Sometimes it becomes clear early on that a candidate is not a good fit. In such cases, it is important to end the interview tactfully. A simple and polite way to do this is to thank the candidate for their time, state that you are looking for a different set of skills or experiences, and wish them well in their job search. This approach maintains professionalism and leaves the candidate with a positive impression, which is important in a small, interconnected professional community. When you find the right candidate, present the job offer clearly and positively. Outline the terms of employment, the expectations, and the support they will receive. It's also beneficial to express why you believe they are the right fit for the role, highlighting aspects of their interview or experience that impressed you. This not only reinforces the candidate's value, but also begins your working relationship on a positive, affirming note. If a candidate declines a job offer, respond graciously. Express understanding and appreciation for their consideration. Ask if they would mind staying in contact for potential future opportunities, or if they have any feedback that could help you in further recruitment. This maintains a professional relationship and network, which can be valuable in the caregiving community. Onboarding should include a thorough introduction to the patient's specific needs, preferences, and medical requirements. It is also crucial to establish a clear communication line and regular check-ins to support the caregiver in their new role. Ongoing training opportunities not only improve the quality of care provided, but also help keep the caregivers engaged and updated on the best practices in dementia care. Ensure that all hiring processes comply with employment laws, including those pertaining to discrimination, privacy, and labor rights. Ethical considerations should include respect for the dignity and rights of both the client and the caregiver. It's essential to have clear policies in place that safeguard the interests and safety of all parties Effective recruitment for dementia caregivers requires a blend of empathy, diligence, and strategic questioning. Your goal is to find someone who not only fits the technical requirements of the job, but who will also provide compassionate and adaptable care. Remember, the right caregiver can significantly enhance the quality of life for someone with dementia, making your role as a recruiter critically important. Be thoughtful, be thorough, and always aim to act in the best interest of both the client and the caregiver.